Resources, Judge Leifman and Rick and I all served on a national judicial task force to examine the state court's response to mental illnesses. And that work resulted in many recommendations adopted by chief justices and state court administrators across the nation, and numerous, over 100 publications that you will find of value to your work going forward. There are other items that will be included on the website, but we just wanted to give you that update, and it'll be coming your way soon following review. And thank you again for all the work that you're doing, and we look forward to continuing to support the task force work and each of the subcommittees. So with that, if there are any quick questions, I know you're on a very tight schedule. So I'll turn it back to you and Kate to see if there's anything further we can offer.
Any questions?
We've been told we should kind of comb the community to find resources that could serve on subcommittees. I've done that. I have some thoughts on it, but how do we share those names and that sort of information to get them on a subcommittee or involved in this organization?
Very good question. So that is the second half of our meeting. There's a worksheet in your packet that I'll be going over in my part of the presentation. So there's a space for names. Then I will also be emailing.
Okay. All right. Thank you.
Thank you. Scotty.
You had mentioned the some of the models that have been developed by the county and different officials. Have we approached tribes on some of their models to drug addiction, to homelessness, to housing, to some of these other aspects that we're approaching?
Law and justice. Patty, did you hear the question?
I didn't hear the question fully.
So,
Can you hear me? Can you hear me okay?
Now I can.
Okay. Have you had mentioned that some of the models that had been developed by the counties and different entities, have tribes been approached about the models that they've developed for their own communities? And in regard to drug addiction, law and order, to housing, some of these different aspects?
We were very fortunate in that invitations were issued to a broad sector, broad community engagement to join the asset assessment. And so included are the attendees at the asset assessment. So you can make sure that if there are others that need to be reached out to either by the task force or by the Leifman Group, we'd be happy to do that.
Sky, I'll check.
yeah,
Okay.
yeah. I was gonna say we'll make sure that we have some focused conversations around that.
Yeah, and I can provide resources and connections to some of those spaces as well. As well as
That'd be
others in the room.
We need to.
Can I just add to that, that specifically out of the assessment process, there were a number of those pieces identified and those resources that were compiled and sent. And so that would all be the pieces that need to get rolled up into what you're receiving.
Yeah.
Because I'm looking at a few of you in the room, Tony and Angel particularly, they both gave us a long list of pieces that weren't in the original set of information.
They're my first phone call, so.
Yeah.
Yeah. I can mark that off the list.
And whatever gaps that we see, we will follow up with. So this isn't a one-time touch tonight. Right. So
Well, thank you. Thank you again very much for inviting us to the task force meeting. We look forward to hearing from you at the next task force meeting. So thank you so much. I have to get off to go to a doctor's appointment, so I'm sorry we'll have to leave you.
thank you,
Thank
Patty.
you.
Thank you.
All right, so the other part of today's meeting, a very important part, is launching the subcommittees. Kind of got into it last time that we met in November. Kate's going to give us a little bit more details.
This is gonna be the really fun part. I'm really looking forward to this because this is where we're gonna actually try to knit all of the things that you're already working on into a continuum of care so that people in need don't experience any gaps. And I'm pretty sure we can get there. So as we're gonna take all the material that Patty just talked with the asset assessment plus more, and at the subcommittees, what each of the committees is gonna do is they're gonna describe what the need is, have a really clear understanding of what you're currently doing, what's in place, and then identify where those gaps are and make recommendation on priorities to fill those gaps. And also, very importantly, we'll add how we're going to measure if there's success, because we're going to invest time and money in the community, and we need to know that it is being used successfully and making a difference. And the other principle that we have with this, we have talked about it in the beginning, but we're going to be really clear about what is working now before we start talking about new things that are needed, because there are a lot of programs you heard that are working now. There's a lot of money in the system, but maybe those things are not aligned. So the subcommittees are going to first look at what is working and where the gaps are and see if we can align. And then at the end of the process, look about what do we need that might be new in terms of resources. And we'll also ask the subcommittees to be thinking about implementation considerations, like this one won't happen unless we put some training in place. Or this one, we need to have some more data that tells us this before we can do it. Now the subcommittees, there will be really good support. We're spending the next month or so with the information that the Lifeman Group has made to make a really good starter packet for the committees so that you're not starting from zero. You have pretty good guidance about what's in place and where you need to go. We hope it's going to be a long month. But so one of the things that we have developed and have got some input from you is we're going to have these committees. We want to be really clear how they're going to work and what the responsibilities are. So in your packet today is what's called the subcommittee charter. I'm just going to do a couple points from it. We've already gotten some input back on it and are happy to have more input because it talks about what is the purpose of the committee? What are the outcomes what are we looking for in outcomes when they get done their work? What is the time commitment? They're going to start meeting in February, March, maybe January, February, and March. And it's going to be a 4-hour meeting once a month, plus maybe a commitment of an hour or two before the meeting to read and digest and be ready to participate when you get there. We really want everyone on the committee to do their best to come in person to the meetings. We think that's going to make a tremendous difference. And we are still, as the judge said, we are still collecting names for the subcommittees that we're going to spend the next time after I get done talking about who needs else to be at the table and where else are they going to be best to participate. We also, on page 3, talked about we are asking people on the task force to take some leadership in the committee so that we have really good connections. So we're trying to have 3 task force volunteers, and a couple of people have said yes. I'm going to tell you who they are now for each of the subcommittees, just so we have good alignment. And that group of subcommittee chairs is going to be, so there'll be 12, 3 for each of the 4 committees, is going to be almost our executive committee for the task force, people who are well informed, who can call on when people in the community have a question or can talk. So that will be their role. And then the task force chairs, their role is having a good culture at their task force meetings or their subcommittee meetings when they meet, and also reporting back here so we make sure that everybody is moving in the same direction. We also put at the end of the memo internal procedures and norms, and we'd like you to look at that. Did we hit everything? We want the committees really to work well. We put a thing in about transparency. I am a very strong believer in transparency. Is always but the subcommittees like this meeting are not open to the public, but are recorded. All the materials that are here are put up on the website. So we want everyone in the community to know exactly what we are doing. So your subcommittee meetings will not be open to the public, but all the material and discussion from it will go up on the website so everyone can access it. And then we had questions at the beginning about decision-making, which will definitely be by consensus, and we put some ideas there about how that might work. And you all have a lot of good experience working in groups, so if you have anything to add there, we'd be happy to hear that. So let's talk a little bit about the committees. There are 4 committees. Aligned, because you have not only 1, but 2 SIM analysis already done with a lot of information. We are aligning the committees with that, and that is the National Best Practice in Mental Health. So there are 4 committees: prevention and crisis response, custody strategies and court, reentry, discharge and community corrections, and facilities, infrastructure, and system coordination. This is based on the SIM model, but also the experience of the Lifeline Group and the work they've done elsewhere about the best and most efficient way to organize this and where your changes should happen. So here's a little bit. We've done a start for each of the committees. They're gonna have to, oh, thank you. I'm supposed to be doing my own, but I forgot that part. So the first subcommittee A, and this is just your starter list. We'll have a much better list based on the asset assessment by the time we get to the committee work, but so that you can get an idea about this. And thank you for subcommittee A. Justin Johnson, Jan Dowling, and Dr. Mace have agreed to be the chairs for this. Thank you very much for doing that. And here is, in general, the issues that that committee will be looking for. And by the way, this PowerPoint will be up on the website for you to go back. So let's look at subcommittee B. This is custody strategies in court, improving the use of screening and assessment and diversion for people who are already entering the justice system. And here's the kind of things in the bullet points that that committee will be working with. And thank you, Judge Hazel, Mike Sparber, and Eric Lamb have agreed to be the co-chairs for this subcommittee. So thank you very much for that. That will bring some good work there. So then subcommittee C is about reentry. When people are coming out of the big systems, the healthcare systems, or the justice systems, how can we make sure that they don't come back? So this is a committee that's going to be working on that. And we're still working on leadership of that. We have the ass out. So, and we will, as soon as we know, we will let you know. And then finally, subcommittee D, what's the facilities and infrastructures we're going to need in the future? And all kinds of facilities. It's a continuum of care. So it'll be all the way from various mental health options that we heard today about from Dr. Velasquez and Justin, what we need in the justice system. And data is a big piece of the infrastructure for this. So this is a subcommittee that's going to look at what do we have in data and how do we make sure that we could coordinate the data enough to know that the things we are doing are working. And that's going to be a tough one. So it's going to be a really big brain committee. And thank you very much. Chud Wendell, Matt Albright, and John Brown have agreed to chair that committee. So that will be great. So that's a little bit about the committees and where they're going. We'll start in January. And so with that, I'm going to turn it back to Sue to make sure that we have everybody at the table engaged with us that we need to.
Any quick questions?
Oh,
Great.
go for it.
Troublemaker.
Tony, I saw you first.
Is there any opportunity for further discussion? Because I think it's missing very important dimensions. I think the leadership that you've identified is not inclusive,
Okay.
and I think we need to have a talk about it.
Okay. Happy to do that. Thank you. That's why I mentioned it. That's why I mentioned the names. Yes. We'll do that so that we could get that feedback. Thank you. We will definitely do that.
Yeah, Kate, just appreciate your discussion around providing starting list. I think we talked about that before. There's been a lot of work done prior to the task force to include Judge Leifman's group, what they see when they come into the community. The question I have is, have you thought about size, right? We want to make sure we have inclusive representation, but also if the subcommittees get too big, it's really hard for co-chairs to manage, relatively large groups. I don't know if there's been any thought to make sure we have the appropriate representation and it's inclusive, but at the same time, not just open it up so that, you're getting to a point to where it's really hard to drive any actionability.
Yeah, that's been a back of my mind issue. And so one of the things Sue has done is set up the engagement on everything from getting the newsletters to the subcommittees. So we're going to ask you in your groups this morning to look at the people that should be, want to be engaged and figure out where on the continuum they could be. So we want everyone to participate, but not everyone to be on a committee. And perhaps the criteria for committee that is 3-4 hour meetings that you have to go to the work might help people determine what kind of level of commitment that we want, but we're going to ask your judgment on that. Maybe some people a one-on-one visit would be good twice instead of being on a committee. So we're going to have to sort that out because we won't know the answer to that one. And I saw another question, comment, Angel.
Just to kind of echo what we'll kind of round up both Matt and Tony's suggestions. It is really important. There's lots of us who have sat at these tables trying to figure this out. And that has always been the most critical piece, is that inclusivity. In my mind, I really see folks who have been of service to folks who have been impacted by our county jail and these systems, and people who have been subject to them. So I think it's really important that each group, and I'll even stretch to say that in the leadership that there should be somebody with that experience grounding each and every committee. And I know you said that there's that second part, so I think a lot of us are really anxious to kind of see who these other suggestions are. And then the other thing is that with that, if we forward thinking about folks with actual lived experience, having been incarcerated, having been subject to these systems, you know, maybe we won't see them in the room, but they will be participating, because often, you know, it can be a really intimidating speed. And I do know from experience, since my picture was posted with many other people in this community, that, you know, a lot of people are already very critical and had to come to me and finally say, hey man, like, what's going on, Angel? You joined the other side, or what's going on? but you know, I'm just saying, you know, as part of the community, I think it's important for me to be here, and I think that others like me, it's really important for them to be here as well.
Thank you for bringing that up, and I apologize that you had to bring it up again, and Tony, that you had to. You know, I'm from Seattle. I have seen these fail when we did not meet that criteria. That is, if we don't do that in this, it will not succeed. And thank you for the patience to bring that up again. We will work on it. Yes.
And I just want to make sure that that we're preventing silos as well. So with these subcommittees, it's really important to be able to focus on a specific target, right? But as we come together and we talk about our successes, let's make sure that we're keeping our ears open to the ways those successes tie into each other subcommittee. This is a cycle, it's a process, it's, you know, you can see it on the page. So as we do our work, you know, keep these other processes in mind. When you're talking about prevention, when you're talking about currently incarcerated individuals, think about the entire timeline, as opposed to just your sole focus. Keep it in the back of your head so that we're making sure that our solution is well-rounded and all-encompassing in those spaces.
Thank you. That's a very good reminder. And we'll be looking to set up a process where that's going to have to happen as a part of going through the committees. And if we don't get that right, let us know. Let me turn back to Sue.
Holly, did you have your hand?
Oh,
Tony?
So I would just suggest that this is probably my 5th meeting this week about how we're going to fund things. And there was nothing in any of the bullets about how we are going to fund this after the opioid settlement goes away. And it is Medicaid. So we have to have that conversation. Justin knows this. It's this whole system, our solutions are going to be run on the back of Medicaid. and we have to preserve that funding. We have to advocate for it. But also, we know now and I've been running treatment programs and clinics for 45 years. I'm the oldest one in this room, I think. Social determinants of health are what makes the change. It's not, I'm sorry, judges, it's not the courts so much. They direct where you go.
Can you say one more time on what you said?
Social determinants of health, community makes the change. It's what we're saying here. Connection to community, connection to culture, connection to, the purpose of rehabilitation is to return you to the community which you came from. It's not to change you, not to make you better, not to shine you up. It's to return you to the community which you came from. So where is the segment for social determinants of health, community, funding? How are we gonna live with this for the next generation?
Thank you. And what that needs to be more explicit. But what you made me think of is how important that's going to be in deciding what measurements we have of success.
Absolutely.
Yep, because that's where that's going to, right. You do what you measure. So, okay, that's a good reminder. Other comments?
All right, now can go back to the.
I wanted to make sure that I got down. Okay, so we're up at the top of the hour. Last meeting, we had a little question up here on the board. And the question was, what values should guide the task force's decisions when perspectives and experiences differ? So some of you were able to write some really great ideas, and then others built off of that idea. What we did was, based off of the conversations that have been happening, what I heard at that last meeting, started to create these buckets of guiding values. So when we have those hard conversations, not just in this room, but in the subcommittees, we can look back and say, does this meet the criteria, right? Is this really getting at what we need to get at and how we want to respond as a group, as a community, as a continuum of services of network? So 2 things here. The first line is what those values are. And then the third, but the black italicized is how these apply to the work that you are doing and the conversations that we have. Dignity and humanity, values and ethics, it's grounded in that. Data-informed decisions, we heard a lot about that. And all the work that the Lifeman Group has been doing around the assets, which is still being processed and slightly incomplete. That's the process and the methodology. Trauma-informed, healing-centered, and historical accountability. That's the lens and the framework that we need to be looking through this. Meaningful engagement with lived experience. So not just engaging with them in a one-way conversation, making sure that there's collaboration, there's constant communication, that they feel part of the solution because they are the ones that are experiencing it. Transparency and accountability, governance and trust. We all know that there is a deep distrust within communities that are seeking services. So how do are the conversations that we are having and the solutions and the recommendations coming in, are they reinforcing some type of trust or are strengthening the trust that the community needs? Collaboration and shared learning, partnerships and growth. That's why you're all here. That's why you all represent different aspects of the continuum. Root cause prevention and responsive intervention. That's the strategy, right, and the action. So I'm going to leave this up here. I'm going to give you all a minute. I know this is the first time you're looking at this. I want you to sit with it. And then, am I missing anything? Are we missing anything? Is there a category or a theme up here or that isn't up here?
Sustainable.
Okay. So resilient and sustainable system.
As a necessity, following the rule of law.
Thank you, Judge.
think I can't do this. These are.
You have data-informed decisions up there, which I agree with. I also think we should consider adding evidence-based or evidence-informed.
Right.
Or culturally established.
Culturally established. Thanks, Tony.
Cultural norms.
Cultural norms.
Can I offer culturally responsive?
I don't know what that means in my
Okay.
community. It's the norm.
Maybe outcomes based. I mean, we have process, method, so data informed decisions, you have strategy, you have the word action, but whether it's action oriented or outcomes based, you know, we can talk for a long time, but like what are like the actions, the outcomes that we are driving, the sustainable outcomes and actions we're driving?
Can I ask a question? Did anybody else have a negative reaction to following the rule of law?
Yes.
I did.
Yes, very much
And I don't
so.
know exactly why. I understand that there are things that are in place, but I'm not sure that should be a primary focus on the solution.
So
Thank you.
I
I'm
also.
sorry, I had a negative
Yeah.
reaction to it.
Thank you.
If I could, I have a negative reaction to it as well, because we don't always have effective laws, but as a judge, we are required, it's one of our fundamental foundational requirements of the judiciary is to ensure that there is rule of law so that democratically elected laws are given effect. And so it's not a choice from a judge's perspective.
And I understand that, but I would argue that we're trying to affect change, and it may include changing that.
That makes
And
sense.
so I don't wanna,
Yeah.
I don't wanna put up a wall.
Yeah, the rule of humanity.
There we go.
How about decolonize? Let's decolonize, because that's what got us here. The rule of law, how we do business is what got us here. What are we going to change?
I just don't wanna put up a wall to a solution if the solution means changing that.
Yeah, because legislative changes, I mean, there's.
It's possible.
Exactly.
Doesn't
Right,
work.
right.
So I don't wanna
think we're
start
I
there.
don't think we're necessarily talking about the rule of law, but more about accountability, right? So if someone's dealing with drug abuse or dealing with homelessness or all these different things and it causes them to break a law, let's provide them the resources that they need, but also hold them accountable for the things that they were engaged in, to the degree that makes sense, for that instance. So,
It's not either or, it's a yes and.
yeah,
It's a
yes, and provide the resources, but hold
What
them
you're
accountable.
saying
in that
matters and what
space.
you're saying matters.
What
yes,
I
and-
meant, I'm sorry, I should be more clear. Actually, what I meant is if we come up with a solution and that solution violates a statute that's mandatory, we can't do that solution unless we get legislative changes. So it needs to incorporate legislative lobbying potentially, but we can't put in a structure in place or a solution in place if it's violative of Washington law, and it's not a choice. It's something we're compelled to do as judges and frankly as every other stakeholder.
So let me clarify, we can have recommendations that do not follow current law because the recommendation is to change that law to allow us to do that.
Right.
That's my point.
Yeah, okay,
I'm
got it,
100% in agreement.
got it. Okay,
Sorry.
that was
Sorry,
great.
I'm not going to be
That was
quiet.
wonderful.
Yeah.
That's exactly what we wanted to get at with this question here. So thank you for all of those perspectives, because again, that's part of why we are here. So a little bit about the continuum of engagement. So this right here represents the range of engagement approaches where different groups and individuals based off of their current trust level, right, resources available to them, time, that we want to recognize that folks are going to enter this at different and participate at different various levels. So we want to make sure that we are covering the entire continuum. And I call it a continuum because it is built on trust. And you might be starting at the stay informed, but as that starts to build, you could be moving up. The other thing is, folks have a lot of conflicts in their life. And so making sure that the opportunities for them to participate at the level that they feel comfortable and they feel seen and heard is a core part of what we are going to do around the engagement. But to do that, we really need your help. So there are several ways, tools and techniques, and this doesn't even really like get at them, ways for people to engage. And a lot of these we've used in the processes that we've been part of. The other thing is I'm gonna switch through this, but this is in your packet because this leads into the next part of the conversation that we're gonna have. So potential tools, again, we need your help on what those tools and techniques are. So we can guess, right? But you all are part of this community. You work day to day with these individuals and with these groups. So these are just potential tools. You just see one up there, but does not mean that we are not going to do some of the other techniques and activities that you saw in the previous slide. So we're going to move into small group discussions now. So in the tables that you are currently at, we have the rest of the time. The purpose of this is really to identify those voices and the stakeholders, community leaders that are not at the table right now that need to be. So what I would like to have at the end of this is 5 to 8 recommended participants. It doesn't have to be 5 to 8. You can put more, less if you can't think about it. You all have our emails. But the idea is for us to start talking about, again, who needs to be at this table that you do not see around the room. And then why they're important to the group. And then where they may belong or where you think that they would feel comfortable entering in at the continuum of engagement. So some of the discussion questions that we have, again, this is in your packet. Who needs to be at the table to really reflect Spokane's realities and whose voices are missing? So Native Nations, tribal leaders, frontline staff, neighborhoods, youth, health providers, businesses, community organizations. Really want to be creative and really think about who's affected and who hasn't been part of the conversation that needs to be. Who should be involved in ongoing engagement and subcommittees? Also part of your packet, right, is the subcommittee information that Kate had gone over earlier, so you should have that, but if there are questions around that, we'll be traveling around the room. And then what level of involvement is appropriate? So again, if you need any explanation of what those different categories or phases are, raise your hand and one of us will come over.
Are the 4 subcommittees listed somewhere in our material?
They should be as part of the subcommittee packets. Or actually, I can put it up. I'll put it up.
I didn't see it in there, so I wasn't sure if I was looking at the right
In the subcommittee charter and the overview, it's not there. The 4 bullets. First page.
They'll only need the prompt.
They don't need that.
I already forgot what it was.
Thanks for being guys. All right. So you've got about.
I'm trying to understand who we're trying to identify for what purpose, because we have our task force, we have subcommittees who are doing work. You're talking about community engagement. Are these groups and people that the task force is going to be communicating with during the process? And what would the task force be communicating? Are they people for the subcommittees? I'm just trying to understand who we're looking at in terms of, and why we're looking at that engagement.
So why are we here? It's actually all of that, right? So the subcommittees haven't been set yet. We named off a couple of folks that we thought have been identified as leaders. That's still something that maybe we can discuss. But in terms of the subcommittee groups and participation, we don't have that. The other bit of it is this can't live within this room and even within the subcommittees. So the other part of that is the broader engagement with the community. And again, we didn't want to make any assumptions of where of who we thought should be at the table and where they would come in. So it's kind of why we want to go through this activity of, you all helping us define or refine what that the approach and the engagement strategy would be.
Are we assuming that each one of us will sit on one of those subcommittees?
Go ahead, Kate.
No, it's up to you.
Or we won't make you.
We won't make you.
I will.
That seems like a commitment we should make. I know.
All right.
But there are other ways, like, you could say, I know a community pretty well. I would like to get together as a group and talk to them. So there are a lot of different ways that you could engage people that you know or you think should be at the table. Could have a one-on-one meeting with someone.
See?
Yeah, just not to change the question, but to maybe get at the questions of like, who we talk about here. One, I think, when you think about table, we're not literally talking about, it's not a literal, it's a figurative idea, right?
Yeah,
It's
thank
about
you.
like, who needs to be engaged in this? The second piece of that I would say is like, imagine we're 5 years in the future and we're a community that feels like we're on a really great path around how we address public safety and public health issues and how our community members feel engaged and feel like they're a part of the community. That would be different than where we are today, which means that would mean this process is different than any of the others that any of us have been involved in before. What's the difference? Who was it that was engaged in that helped to make or shape that difference? So that may be a way to think about it. And it could be that it's like, well, here's the folks that really need to be informed about this, need to understand what the difference in change is, as to the community engagement spectrum, all the way up to like, who's really leading this process? What are the voices or perspectives that are there? So I think that, think about like, if we are successful in why you're all showing up for 3.5 hours a month, plus maybe now another 4, what is it that would make this successful in terms of who's engaged? And I think those can be names, those can be stakeholder groups, those can be communities. Like don't limit yourself in terms of what that looks like. We'll figure out together how we actually get there. But really, it's about how do we make sure that we've identified the right set of folks for this to be a successful endeavor together.
It's an ask, right? I mean, just because their name is recommended, like we still have to do the work of going to them, right? And talking about what this entire project process is about. And I will say though, we will need your help, right? Is that the relationships that you all have and the connections, that will help us kind of, again, right size this effort. So we're not making these broad brush assumptions about who needs to be involved. Angels?
Oh. Right off the top of my head. Oh, I know. I would like to, can you read again who already made a commitment to the subcommittee A?
Okay, subcommittee A.
My stages are out of order. Getting there. I'll write it down and bring it over to you in a minute.
Okay, thank you.
Sorry, I don't want to hold this up from diving in, and I know I arrived late, but I just want to sort of clarify whether the activities outlined here on the continuum of engagement are ones that this group or you are planning to pursue, and we have a plan for that, or is that still in flux?
That's still in flux. So that's part of the reason why we included that entire list. And then on the back end side of that, right, is the potential tools right now that we see. Again, that's going to be dependent on, I mean, maybe the coffee chats, right, replaces some of the focus groups and interviews because those work better, right? It's more approachable. Maybe it is town halls, or is the survey the right way to, and those are the questions that we will be spending really now until the next time we come together next month, hashing out.
What is the website address?
Shame on me for not knowing.
safeandhealthyspokane.org.
Thanks.
All right, so we're gonna break. You're at the tables that you'll be working at. Again, you know, we mixed this up intentionally so that way you have a spectrum of representation and communications right there. So, all right. Break in the conversation.
All right. I love how you're like,
Well, I just thank you. And there were parts of
Providing them on us, part of that's time. It would be nice to, introduce those. I see that all get done. Then you get to resources. There's folks here okay. I'm not sure they need to be part of just like that.
Yes, and I can think of community health centers, because that's one aspect.
Awesome. I mean, from my perspective, I would love it because it's trying to solve it. It's nice to have someone. But here's the problem right now. I would say that's of course, I can use some of the swing stuff.
Okay, great. So being able to take bird's eye view. They need a swing set. When they get down there, they realize that really needs something. So I think that public really knows he's some of those spaces. I don't think. I don't know them when they're walking through.
Right? No.
I'm gonna be some announcement.
So we get it, but we're doing that. It's just big issue. They really like that.
Yeah.
I think the parents will get like using that's all prevented.
That would be huge.
Kids who are going to these different public schools.
Yeah, you know, it's.
Violence, whatever it is. Every now and then we'll get really help us. We don't know what's one thing also not seeing is pirate.
I think we were very
Yes, do organizations. If we're going to be talking about post whatever it is, we have to have whether it's certification like there's a low myself and Empire Health the season changes, change their initiative and it's unreliable. Also not to work on have this funding from the government.
Yeah, I know. But that was part of it. Very. I wasn't around. That was a story that was told.
I just had to.
So Ken Richards on the Gonzaga but it may
have a lot of housing as well.
It may not necessarily be a subcommittee member.
Yeah, the way I look at it is,
I know when I was growing up,
so, like, these yeah, so I see. You really have
What else? What is this post? We need programs. That's why. Leadership. But then we don't. All right. I made it deal with co-chair. But that's why we're actually.
No.
And then I'm just gonna say
So we have about.
Right. So I want to be respectful of everybody's time. We are about 7 minutes till 11. Sorry. We will be picking up any of the notes that you have from the worksheet. So make sure you leave that on the table. But we did have a update at the beginning that we weren't able to get to. So I would love to invite Maggie up here.
Hi, everybody. My name is Maggie Yates. I serve as Mayor Brown's Deputy City Administrator. I think I know just about everyone in the room. Really appreciate the honest conversation and dialogue that I got to hear when I arrived, and just really urge our facilitators to help create more space for that I've been involved in at least one effort before this one to try and tackle our criminal justice system and our jail, and I know several of you have been involved in more than me. So I empathize with the sort of sense of fatigue and exhaustion. I just have a lot of respect for all of you coming back and sort of committed to challenging each other and challenging the community to figure out a way to do this better. I was asked to just give an overview of some of the interventions and investments that the city has made. I want to highlight some that are longstanding and then some more recent ones. Some of you are familiar with all of them, some of them, none of them. So first of all, we've got AC Coles here from SPD. SPD has had a behavioral health unit with the department for several years in partnership with Frontier Behavioral Health, and we have Jan Deckingham there. That pairs a behavioral health clinician with law enforcement to respond to behavioral health crises in the community. I just saw them on the Monroe Street Bridge earlier this week doing impressive work. So that's something that we have really been leading the country in. We also work with Frontier Behavioral Health to staff our behavioral response unit with the fire department, similarly structured. We have a behavioral health clinician partnered with soon to be a full role paramedic, and they respond to medical crises that are behavioral health related. So big thanks to Jan for all of her partnership in Frontier. Also a huge thanks to Justin Johnson and the county because they just invested in the city's behavioral response unit with fire. So we have expanded as of last month our hours for those crisis services. We used to just work about 40 hours a week. We're almost at 80 hours a week now with our fire department. So some really exciting developments and partnerships there. The city also under Mayor Brown made our first investments of the opioid settlement dollars. We've been accruing those from lost legal actions against the manufacturers and distributors of opioids. And so we've made several on our own and several with the county. Justin, did you cover our joint investments earlier?
Briefly, I left the rest for you.
Okay, great. So we've made joint investments in expanded medical assisted treatment, which are still in development. We expanded sobering beds at STARS together, and then also made investments at Maddie's Place for infants struggling with neonatal abstinence syndrome. So some exciting stuff there. The city also has made our own investments with our opioid dollars. We expanded our CARES team in the fire department. The CARES team is a team of social workers that receive referrals from firefighters. So if they go to a response and they're like, this person needs some follow-up, some case management, our CARES teams respond. They can also track high utilizers of 911 who they don't have the resources they need, so they just rely on 911 responses. Our CARES teams identify them, go and provide those case management stabilizing services. They're now following up on overdose calls with our investments. So whenever there's an overdose that our fire department responds to, CARES goes within 24 hours to provide follow-up and stabilization services. We also hired a data analyst to help us better understand and coordinate our data when it comes to the opioid epidemic. So he just started. That work is just very much at its infancy. We reinvested in consistent care with our Hotspotter initiative. That's a longstanding program that lost funding along the way, and so we jump-started it. And they basically are focusing on high utilizers, folks that cycle from the jail to emergency departments, our shelters and streets, and they're providing what Dr. Nevin Lee's consistent care calls a social ICU. They provide intensive case management services for this small population of folks. They are providing medication-assisted treatment enrollment. They're providing antipsychotic, long-acting antipsychotic injectables. They're giving folks cell phones so they can stay connected to their service providers and other resources in the community. So that's been going for about a year, and we're just starting to review that data. We also just recently released a funding opportunity through our opioid settlements for culturally specific opioid interventions. Basically, we know that white patients are 3 times more likely to get Narcan from a visit than a Black patient who might be presenting with the same symptoms. We know that success rates in treatment vary across race and identity, and so we want to make sure that we're investing in interventions that give everyone in our community the same opportunity for success, health, and stability. And we're looking to providers in the community to give us the research and the evidence and the solutions to help further that aim. So with that closes December 15th. If anyone's interested in applying and needs more information, come up to me after this. We also, I think it was in 2025, recommended to City Council, who adopted a community health impact area. This did a couple of things. One, it brought back an alcohol impact area downtown, which had inadvertently been repealed under the last administration. And that limits the types of alcohol that can be sold downtown, sort of mirroring the downtown precinct boundaries. It also limits the hours. And we know that the alcohol consumption is also linked to narcotics use and trafficking as well. So we're in a voluntary compliance period with vendors downtown, and then we can petition the Liquor Control Board to make that permanent, and had great support from the Downtown Spokane Partnership, bringing that back. The second thing the community health impact area does is requires Narcan to be provided for free at the time of sale of any smoking supplies downtown. We know that folks go to places like next to the STA, stop in a convenience store, and there's glass pipes and tinfoil that are used for narcotics. So we're saying if you're going to sell that, then we also have to have Narcan on hand and provide that to folks for free. So those are a couple of things that we achieved through the community health impact area. And then just earlier this week, the administration proposed a ban on kratom, the sale of kratom as well, which is a sort of similar to opioids, although not an opioid. So we'll see how that navigates through council. Similar or related to Narcan distribution, we partnered with the health district to get Narcan at our library branches. So within the city's library branches, you can pick out Narcan. I know this group knows, but I cannot stress enough how important this is as a medical intervention. I was walking to work across the Post Street Bridge one morning and heard someone screaming for help and just knew something was wrong and took off running. I was the first person on scene, called 911 for an overdose, and I did Narcan on me. And I was walking up to folks on the Centennial Trail, running up to them saying, do you have Narcan? Do you have Narcan? And there's such a stigma. Folks saying, do I look like someone who would carry that? Fortunately, our fire department arrived on scene and was able to revive the individual with Narcan. I now carry it. I have it on me right now, and just encourage everyone, if you don't have it on you, please get it. And you can visit our library branches to get a free dose. We also launched the SALSA program, which is a Special Assistant U.S. Attorney. The city funds a federal prosecutor in the federal prosecutor's office to pursue high-level drug trafficking cases. We're not going after subsistence dealing here. We're trying to find folks at the top of the chain to reduce the amount of illicit substances coming into the city of Spokane. Justin Bingham, our city prosecutor, worked very hard on that partnership, so thanks for all your work there. And how many cases did she have last count, our SALSA?
It just kept growing and growing. It was a shocking number. She had, I think, 15 active and 30 to 40 in the works, which, if you know how many cases federal prosecutors carry, that is a shockingly high number of active cases.
And that is funded through our cannabis tax, not our opioid dollars, which is a more sustainable funding source because it doesn't term out with the end of the settlement. So those are some ones that are longstanding and then more recent. And then our very, very recent investments just came online in October. And that includes geographic-based outreach teams. So now we have 4 police precincts. We now have 4 outreach teams in partnership with Catholic Charities that are aligned with each of these outreach areas. If you see someone in distress on the streets, you can call 311, our city's sort of hotline, central hotline, and they will dispatch this outreach team to go near real time to individuals and respond to them with case managers. Our police department also works very closely with our outreach team, and they will call them and say, hey, this is a case management issue, not a law enforcement or safety issue, and they'll work very closely together. Our outreach teams are working with 40 folks weekly, if not more, last I checked. And then these outreach teams can navigate people to our newly launched Day Navigation Center that's operated by Jules Helping Hands. It's based in Browns Edition, and that is open 7 days a week. During business hours, folks can go there to get a meal, a shower, have their laundry done, and then there's case management on site there. And we have also partnered with Providence's Community Clinic to have behavioral health providers on site there as well, and there's other providers that circulate throughout the week. So now law enforcement has a place to say, hey, this isn't an okay spot for you to be, or hey, do you need help? Here's a place for you to go, and we can actually navigate folks to a resource. And then our outreach teams do the same. We're seeing over 100 people at the Day Navigation Center every single day. And then I failed to mention our outreach teams is operating 7 days a week as well. So those are, I think, some of the big investments and resources that have come online. And there are a few more, but I'll stop there.
Thank you.
Yeah.
Nice work. That's great.
All right, so we're going to close out. I'm going to invite Zeke here to say some parting words for us. Next meeting is going to be January 8th. There is an optional tour to county jails and stabilization center in the PM there. And I believe we're just asking folks to email so that we could sign up.
So I have to have names in advance. So if you're interested, I will need you to confirm by January 1st. We'll follow up with an email, but.
I'll let Zeke talk, but I just want you all to know that this is a very complex issue. And I know that we are trying to build a trust where there was little trust or none at all. And so just seeing how the room is interacting with each other, a lot of the topics that came up really helps us as facilitators, as Maggie said at the top of her announcements, creating that space so that more of that conversation can happen. So I really appreciate you all. And then finally, I'll go to Zeke.
Thanks, Sue. It's overtime, so I appreciate folks staying. Zeke Smith, I know you all are, but not all of you know who I am. I run the Waters Meat Foundation, which used to be Empire Health Foundation. Part of why that's important is because the Empire Health Foundation was one of, if not the largest funder of the campaign against Measure 1 that the county ran 2 years ago, which was also in some ways what instigated this setting, this table that you all are at. And worthwhile for me to just call that out because I sit on one side of a spectrum that some other folks in the room sit on the other side. And that is part of our intent, was to create a space where we could bring folks together who really do represent different perspectives, different ideas about how we should move forward around issues of public safety, and what that means for our community from different vantage points. And you all represent those different perspectives in the conversation. And some of you have been in those conversations many times before. Some of you haven't. And that's also by design. Our intent here is to try to do something different because we cannot continue to operate the way that we have. And I don't think anybody in the room thinks we can continue to operate the way we have. We have really different ideas about what it means to address that. And we're still, there's a difference between intent and impact. And so even today, as we had this conversation, some of what people were saying very nicely was, this feels like something a road we've been down before. And it doesn't feel like we're doing things differently. And part of, I hope you understand your responsibility in being here is to do that, is to say, time out. This isn't working the way that we need it to work in order to do something differently. I feel very responsible for ensuring, in particular, that our communities that have not felt connected to how we address these issues as a broader community are at this table, involved in all the levels of community engagement that Sue talked about before. And you can hold me accountable to when that's happening and when it's not happening. And we're coming together as a leadership group, the business associations and myself. We don't often sit at the table together. This was about actually trying to do things differently from the beginning. And I know we're not always going to get that right, either in the facilitation or in the process or in what we're doing at the table. So I just would continue to invite you to kind of pull that cord at the right time and say, hey, this doesn't feel right. And I heard that today, and we have to come back and we have to address that as we think about moving forward. So keep doing that, please. I have elders in the room that will hold me accountable to that, and I would invite, I'm older than some of you, others of you to also hold me accountable to that as well. And I appreciate you for being here. I know you all know that. I know that each of you are thinking about, why am I at this table? Not meaning like self-doubt, but meaning like, is this actually going to be something different? And is this a table that's going to really engage me in a way that makes sense? I'm asking the same question. And we're putting a lot of energy and resource in, and we don't have the time that we need to actually do the kind of reconciliation work that would be required for us to address the shift that got us here. And we got to figure out how to do that too. So thank you for staying engaged. Thank you for being here. You know how to get a hold of one of us, if not all of us, if you've got ideas about how we can actually make that intent and that impact line up better. Because what I said about, like, wouldn't it be great if 5 years down the road, we all feel like we are in a much better place than we are today around this? And what can you do, and what can I do, and what can we do together to actually accomplish that in the timeline that we've got? Because we got a timeline that is somewhat out of our making. It is what it is, and we want to be able to address that. So there's a lot more underneath that. We can and will unpack some of that, but I just appreciate people being willing to share your concerns and your skepticism and your frustration as we work on this together. Know that our intent is there, and you can help us get to the right impact. So thanks, I appreciate it.
I just want to say something. I was actually the campaign manager that thwarted ballot measure 1 in 2023. And as somebody who's participated in this, gone to Whatcom County, followed this along, I'm just going to say this feels very different than any table that I've been at. And that's why I'm still here. And so, you know, I just want to encourage everybody to kind of listen to what Zeke says, listen to the room. Don't be afraid to speak up, because I'm not going to, as somebody who's an impacted person. As part of the demographic, I feel like carries the brunt of what this jail does to people. Native Americans, I feel like I know, according to data, are the most impacted people in that jail right now, and a part of this system. So, you know, I'm really grateful for everybody's participation, and, you know, and for the work. It's going to be hard. So, you know, I hope that everybody stays committed and stays here. And carry more than one Narcan. Yes. You know, my daughter very recently, last week, she was driving my car and was at a park with one of her cousins, and had to instruct somebody how to do CPR on that person's partner who was in distress, overdosing, while she administered Narcan, and she had to administer 3 by the time paramedics got there, and then they administered 3 more. So just keep that in mind.
So true. Thank you, Zeke, for acknowledging that, because it allows us to know that you're heard, you will be heard, because we don't want to go back to the community and tell other community members to come here and feel unheard, because a lot of us are a smaller group. So when we do that, we lose our system of support, if that makes sense. So we don't want to do that and cause additional harm. So thank you for that acknowledgement. Very much appreciate it.
Great.